points. I'm just going to focus on a couple of really important points in the historical information piece. When you're striking a conversation with the patient, you can apply the dignity question. What do I need to know about you as a person to take the best care of you that I can? And in this way, it's open-ended. This is a form of motivational interviewing where you're empowering the patient. It's an open-ended question. And that really is a great approach when you're taking care of patients who are trans and gender diverse, is to engage in motivational interviewing when you're talking to them. When you're doing a physical exam, it's always important to ask permission to partner with them and also to be able to collaborate with their primary care physicians, particularly if you're starting treatments, medication-assisted treatment, you're not quite sure what the effects are on the level of hormones and so forth. And we want to come from a place of an empowered approach. You and the patient and the family or caregiver is considered one unit. And that really is the best way to move forward with the care, so that their patients are not feeling that they're put at front and center and that they're being judged, because that's, they can feel naked in front of providers. And we want to be able to avoid stigmatizing language. How many times have we heard using the word, oh, patient denies this, patient refuses this? We call, oh, this person is homeless. There are words now that we can use that are less stigmatizing, non-judgmental, right? You want to be able to use some coaching techniques, some scripting. So I included some scripting techniques that you can use. Using the pronoun we need to come up with a plan. So it's inviting the person and the caregiver to engage in a plan. And so it's an empowered approach. And we want to be able to be, talk to our patients in a compassionate, in a humble way, so that we can, engage with them and we can strike a chord, and it's not going to be in an environment where there's a power dynamic, because we want to dismantle some of this power dynamic and but still respect your position as a treating provider, and at the same time also inviting the person as a person who is also capable of holding themselves accountable for future behavioral changes or modifications that they need.